everybody and welcome back to Cradletown. This is Dr. Mridula V. Amarnath here. So I'm hoping that you're doing absolutely great and your journey of pregnancy and now into a new world where you have your little one accompanying you is going great. But then I'm sure you might be having a few couple of doubts. So to just make things easier for you from both a doctor's point of view as well as from a mother's point of view, I've picked up some of the common questions that have been constantly asked, that people constantly ask me, and probably even I felt it was important that you should know about it. So today's 5 questions, we shall begin right now. So the first question which one of the moms have asked me is, my baby sneezes quite a number of times in a day. Is it an indication that my baby has cold? So let me clearly tell you, now sneezing is just like hiccups. It is a very natural, normal phenomenon. On an average, most kids, they sneeze around 10 to 12 times in a day. But as a mother, when we see a little baby sneezing, we immediately think that they have, acquired cold. And then we start them off with some sort of, nasal drops or, medications. But I really don't think that is necessary. See, like as adults, we are able to, any dust particle that enters into our nose, we are able to remove it out or, blow it out or clear our nasal passage. But kids, they're not able to do so. And the only way that they are able to clear their nasal passage is by sneezing. But if the sneezing is accompanied by a blocked nose, that is if the baby has complete difficulty in feeding or breathing, and this is accompanied by cough or fever, then the baby might be having an infection of the upper respiratory passages and will require treatment. So the second question which one of the parents did ask me was, Doctor, we've been told that it is good to instill oil into the eyes, nose and even the ear. It kind of clears off all the debris and dirt from the baby's eyes, nose and ears. Is it true? Should we do it? Well, even you must be thinking that, probably it is beneficial to the baby. Well, certainly not. Yes, in the olden days, people believed that instilling oil into the child's eyes, nose and ears was definitely of great use. But no, in fact, it can be quite harmful to the baby. Now, instilling these oil into the nasal system, into the nose can actually cause irritation to the baby's nose, can lead to blockage of the nose, can lead to increased nasal discharge, can also in fact enter and also cause a breathing difficulty. Sometimes this oil can also enter into the lungs and throat and also cause pneumonia, which is quite serious. Now similarly, putting oil into the baby's eyes can cause a lot of redness and irritation to the baby's eyes. And again, instilling oil into the baby's ears. Now, as long as the eardrum is intact, it is okay. But if there is slight rupture in the eardrum, then this oil can enter into the middle ear and then it can also cause a lot of defect in the baby's hearing ability. So I'll make it clear, do not instill oil into the baby's eyes, nose or ear. It is certainly not beneficial to the baby. So the next question that came in my list was, how should I carry my newborn baby? So in fact, I had made a small video also, so you can check that out, where I've given the different ways to hold a baby. Especially a newborn baby, what happens is their head is extremely, wobbly. It is still not stabilized. So one key thing you should remember is always and always support the head as well as the body while holding the baby. The baby can be carried over the shoulder, but care should always be taken to see that the nose of the baby is not obstructed. See, babies are naturally nose breathers and do not know to open their mouth and breathe. Okay, the babies can also be carried in baskets which are padded with soft cotton mattresses. Now, many mothers like to keep the baby in a sling with the baby coming over their chest and abdomen like a kangaroo baby. Now, let me tell you, this is also perfectly fine, provided that the baby is well supported at all the times. So one other thing that I would like to share is whenever you're lifting the baby, make sure you lift the baby from the shoulder and let's just not pull the hands off the baby, because this could result in the dislocation at the elbow level and something what we call as pulled elbow. So the baby will have a lot of pain, swelling and even a slight deformity, and it is a very painful condition, I must tell you. So make sure that you always lift the baby from the shoulder. Another thing that I would like to share is whenever you're transferring the baby, like from one person to another person, do not just transfer like that. Personally, I find it very risky. What I always suggest is put the baby down on a bed or a cot and let the second person lift the baby from there. So they're also comfortable while, holding the baby. Because just transferring like that is fine. But then just to be on the safer side, especially during the initial few months, right, you will have to be extremely cautious because the baby is it's a very delicate thing. So, it's better to keep the baby on a cot and then let the other person lift the baby from there. So the next question is, when does my baby start hearing? So many parents ask me, doctor, do you think my baby is able to hear me? Because I'm calling him a lot of names. Do you think my baby will be able to recognize? Well, the baby can hear as soon as he is out into this new beautiful world. But the point is, their reflexes, their responses are very, very subtle. So you really can't make out, whether the baby is actually hearing, well, because they're not responding much. But an indirect way or another way to make out if they are responding is, they have a sudden startled reflex when you have a loud, very loud noise. But generally, most parents don't try to do it because you really don't want to have that fear, because it's like a sudden startled reflex which they'll have. So you don't want that sort of you really don't want to see that in your baby, right? Hence, most of them do not do it. But yes, most babies are able to hear as soon as they are out. In fact, when the child is about 2 months, he starts responding to sound in a better fashion, like by smiling or turning his head towards the source of sound. Now, by 3 or 4 months, if he does not startle in response to loud sounds or does not show any visible response to sound, then it is necessary to get him or her tested for hearing. So coming to the last question, which one of the parents asked me is, doctor, I am asthmatic. So do you think even my baby will be suffering from asthma? Yes, it is absolutely normal to have this feeling that, yes, as a parent, if I'm asthmatic, will my child also get asthma? Yes, even asthma also has a genetic component, but not as severe as a lot of other diseases. So asthma, you could say, is a series or repeated episodes of obstruction of the respiratory tract in which there is cough and breathlessness. So normally, even if a baby was to become asthmatic or what we call as a hyperreactive airway disease, it is very unlikely that he would manifest in this newborn period. Now, wheezing, which is one of the characteristic signs of asthma, rarely occurs in the newborn period. So usually this first episode of wheezing usually occurs by around 3 to 4 months of age. So at this point, if you ask, if a newborn would get, because if it would get asthma because the parents are asthmatic, it is very unpredictable. You cannot say. But probably, if the child after 3 to 4 months of age, if the child gets repetitive episodes of cough and breathlessness, then by the end of 1 year, you will be able to term that, the baby has a hyperactive respiratory disorder.